Professor Kalyanam Shivkumar. You're from the University of California at Los Angeles.
That is correct.
And you're head of the Cardiac Arrhythmia Center?
That is correct.
Okay. You were head of a talk about the autonomous nervous system and arrhythmia. What is the connection between these two entities?
So the connection between nerves and arrhythmias has been known for a very long time. Our emotions affect what happens to our heart, and not just our heart, many other organ systems. And the interest of how the brain and the heart, the nerves control the heart, is of great therapeutic significance because it gives us an opportunity to control serious arrhythmias. We think that arrhythmias from the lower chamber of the heart, the ventricular arrhythmias, and also atrial arrhythmias have a very important modulation by the nerves. And this is a big area of research for our group.
Are there any new insights in this field presented on this conference?
In this conference, basically we reviewed what has been going on in the past few years in the field. There was a special session on neuromodulation, which I co-chaired along with Dr. Chen. And we had experts from the world talk about the field itself, what is new in this field, and what we think is going to be in the future. So neuromodulation is, there are many approaches like sympathectomy, stimulating nerves, stimulating the spinal cord, and these treatments are quite exciting, and they are going to become a part of how we manage arrhythmias and also other problems such as heart failure. So this is clearly a field of the future.
And you mentioned renal denervation was a hot topic in treating hypertension.
It's interesting you bring up renal denervation because renal denervation was one of those topics which received a lot of attention. But there was one very disappointing trial that was published, and there were problems with the trial design. But it's also a type of result that one can't walk away from. Our concern about renal denervation is that more science needs to be done. And there was so much hype that now the whole field has walked away from it, which is not a good thing. So there has to be a balance. And one of the points that was made at this conference was if people continue to stay in the field, if good science is done, especially for renal denervation, if we find ways of how to handle the therapy at the time of the therapy, we may be able to identify a correct role for that procedure. So renal denervation needs more science, and I don't think this is the last we're going to hear about it.
Okay, and the modulation of the autonomic nervous system could be a therapy option in addition to ablation, or could it be sometime an alternative?
So it's a very good question. I think neuromodulation could be used before, along with, and also times when ablation is not an option. So, or when ablation doesn't work. So it does not preclude or exclude any other therapies. So that's what the science is going to be done to precisely answer that question. And neuromodulation always is going to be adjunctive in some way, shape or form, because almost all treatments that we've used for heart disease affect the nervous system in one way or the other. And it tries to control this increased activity of nerves. The treatment of heart failure, for instance, almost all treatments in the field of heart failure affect how the nerves control the heart. So it's a field that I think is going to have a very important impact in cardiac arrhythmias.
And are there any side effects we should be afraid of?
It's a good question. Side effects are when you do surgical procedures to cut nerves, such as sympathectomy, there's a small incidence of side effects such as hyperhidrosis, drooping of eyelids, which happens in a very small number of patients. But usually none of these are permanent or damaging. And when you look at the balance between saving a life and having a minor side effect, the balance is vastly in favor of treatment.
Okay, looks like an interesting field in the future. Will we hear more next year?
That is correct, and there's going to be definitely more data that's going to be presented this year, and in the 7th EuroVT meeting, it's quite likely that we're going to hear a lot more about the field of neuromodulation and also the interaction between catheter ablation techniques and neuromodulation.
And looking forward to that.
Thank you so much for the invitation, and it's great to be in the fatherland again. So, thank you so much.
Thank you.